Welcome to Interactive Medicine. This is the part 2 of ischemic heart diseases. In this section, we can talk about the complications after when myocardial infarction occurs. Before, on last part, we end with some complications of the angioplasty or fibrinolysis, which is reperfusion injury and the contraction band necrosis. In contraction band necrosis, this is a clear zoom picture. In contraction band necrosis, the calcium ions get into the cell through damaged membrane and make its contraction. Here we can see the contraction bands. It's like a band. Okay, in this topic, we can study about the complications. What are the complications? We can divide this complication by time from infarction, gross changes, microscopic changes, and the diseases or the complications. Here we can see this is a high yield important table we need to study, but for easing this purpose, I will tell you an approach. Here, first you take the microscopic changes. Okay, what happens when myocardial infarction would take place? There is a necrosis of tissue. That is here, necrosis. After necrosis, the inflammation take places. Inflammation, in acute inflammation, the neutrophils come into play, then macrophages. Then the third process is the healing, which means the scar formation. The entire myocardium or the myocardium is replaced by the scar. Okay, and this picture we need to understand. We need to take. This is the 1 day. This is the time from the infection. 1 day after infection, 1 week after infection, 1 month after infection. Within 1 day, the coagulative necrosis will happen. From 1 day to the 1 week, there is an inflammation will happen, which can be divided into two. The neutrophil comes into play, then macrophages comes into play. Then the third process is from week to month, which include the granulation, which is the granulation is the foundation of scar formation. It is the base of the scar formation. After a month, the scar is formed. The scar is not much strength that much of myocardium. It is weaker than myocardium. Okay. First, we need to understand the necrosis, inflammation, scar formation. Okay. The time from infection, when we take the time from infection is less than 4 hours, there is no appearance of, or there is no changes of morphological and microscopical manner, and the complication may be the cardiogenic shock, congestive heart failure, and arrhythmia. The cardiogenic shock, there is a disturbance in the blood pressure, and the congestive heart failure leads to there is a decrease in ejection fraction. The arrhythmia is occur because of the electrical conduction, because of the conduction pathway. The conduction tissues didn't get enough blood, so there is a dysfunction of conduction pathway occur. This will lead to the arrhythmia. Arrhythmia is a fearful condition after a few hours after. It's a fearful. It is the most common cause of death in first few hours of myocardial infarction. From 4 to 24 hours, which means within a 1 day the coagulative necrosis happen. Not caseous necrosis, it is coagulative necrosis. Okay, and the complication is arrhythmia, and there's a dark discoloration will happen, and in 1 to 3 days neutrophils comes into play. There is a inflammation will occur, acute inflammation, that is pericarditis. Pericarditis will occur if in the transmural inflammation, the fibrinous pericarditis will occur. But if it is subendocardial infarction, and which leads to the subendocardial inflammation, there is no fibrous pericarditis will occur, and which is present in fibrous pericarditis is present as chest pain with friction rub. We can look into this picture. And next will happen, the macrophages comes into this play. What happens when macrophages comes? When macrophages comes, the rupture will happen. All just remember, when macrophages comes, the rupture will happen. The rupture of free ventricular free wall, the rupture of ventricular septum, the rupture of papillary muscles. Okay, let's we can see some idea here. Here is the our heart. Here is our heart, and the right atrium, the right ventricle, the left atria, the left ventricle. Here is the free wall of the left ventricle, and here is the free wall. We know around these around the heart we have the pericardium. When the left ventricle rupture, or the free wall of the heart is ruptured, the blood is leak out from the ventricle to the pericardium, and the blood accumulates between the pericardium and the heart. This condition is known as cardiac tamponade. And next picture which include, what if the rupture happen when the interventricular septum, the blood leak out from the left ventricle to right ventricle, which is known as the shunt. And the left ventricle, here we can see left ventricle here. Here is the papillary muscle. We know the papillary muscle is connected to coordinate tendon, and the coordinate tendon is connected with the mitral wall. We you know the papillary muscles, when the infection happens, and which leads to a rupture, when the macrophages comes into play, then rupture of the papillary muscle may be happen. So what happens, the mitral wall doesn't work very well. So the when during the pumping of ventricle, the left ventricle, the blood can pump back into the left atria. This condition is known as mitral insufficiency. And next we can there is the next is the process with the foundation of the scar formation, which occurs from 1 week to 1 month. 1 week to 1 month. This is the gap. The granulation with the plump fibroblasts, collagen, and blood vessels. Because of the blood vessels in there is a red border emerges from the edge of the infection. The granulation tissue with plump fibroblasts, collagen, and blood vessels happen in 1 to 3 weeks. And because of these blood vessels, there is a red border emerges as granulation tissue enters from edge of infection. And the final one is the fibrosis. The complication is aneurysm. I already said the scar is not much strong or firm as myocardium, so there will be a dilation of the ventricular wall maybe happen. That is known as aneurysm dilatation. And this aneurysm, which what happens in really aneurysm? In left ventricle we have blood, and the left ventricle is dilated, and the blood can lodge into these gaps, this dilated portion. So the flow of the blood is very slow. This can lead to the clotting, that is known as mural thrombus. Mural means wall, thrombus. The thrombus is formed in the wall, or Drusilla syndrome. We need to understand what is meant by the Drusilla syndrome. Drusilla syndrome is an autoimmune disease uh, which happens after months, 6 to 8 weeks. After 6 to 8 weeks, when the inflammation starts, our immune system is response to the pericardial antigen. So our immune system produce the antibody against the pericardium. So uh, these antibodies will react to our pericardium, our own body's pericardium. So it can eventually leads to our death. This process is known as Drusilla syndrome. And the gross changes is white scar formation, and the microscopic changes is fibrosis. I think you get my point. When the what happens when necrosis occur? There is the nucleus is uh, pulled out from the cell. That means the pycnosis, karyolysis will happen, and inflammation is the process with the cleanup of the heart, and after there is a healing process will happen. The foundation of scar formation is granulation. uh, these are the points we need to remember. And the gross changes in the inflammation is the yellow pallor. The inflammation happens within 1 day to 1 week. In neutrophils come 1 to 3 days, and the macrophages comes 4 to 7 days. Okay, and coagulative necrosis occur within 1 day, 4 to 24 hours. And the complication of coagulative necrosis, arrhythmia, very important. And also what we need to remember in this section, the macrophages, we need to understand the rupture. Macrophages leads to the rupture of free ventricular wall leads to cardiac tamponade. And what if the interventricular septum, it leads to the shunt. What if the rupture of papillary muscle happen, then it leads to mitral insufficiency. And finally we need to the scar. What happens if the scar will happen form? Scar, if the scar will form, then it can leads to aneurysm and mural thrombus. Or Drusilla syndrome is an autoimmune disease where the our body produces antibody against our pericardium antigen. And the gross changes in this scar is white scar, which occurs after 6 to 8 months. Sorry, 6 to 8 weeks. Drusilla syndrome occurs after 6 to 8 weeks. And first one is the less than 4 hours. My after initial process after myocardial infarction is the cardiogenic shock. Is due to massive infection and the congestive heart failure and arrhythmia. In Okay, these are the points we need to, and after we need to see some pictures which will helps you for the for easy understanding and understanding this concept. Here is we can see subendocardial infection, which means here the entire heart will not undergo in transmural infection. We can see here subendocardial infection, and also there is a concentric shape of heart and thickened hypertrophy of heart and thickened myocardium. We can see. And here is the coagulative necrosis. The nucleus is pulled out from the myocyte, and we can say epignosis, karyorrhexis, karyolysis happen here. Uh, Here is the neutrophils. We can see neutrophils here. The neutrophils is accumulated, and it is the process with the acute inflammation. How 1 to 3 days it happens, and 4 to 7 days macrophages will come into play, and the gross gross changes is yellow pallor in both inflammation cases. Here is the complication of neutrophils within 1 to 3 days. After 1 to 3 days of myocardial infarction, we can see fibrinous pericarditis. There is a shaggy-like appearance. We can see shaggy-like appearance. Here is the inflammation will go around here, and here is the process which after 4 to 7 days after myocardial infarction, the rupture of the ventricular wall happens. It is because of the playing of macrophages. There is free wall rupture may happen, or interventricular septal rupture may happen, or papillary muscle rupture may happen. And here is the papillary muscle rupture. Here is papillary muscle rupture. This is the chordae tendineae, and the here is what is that? Mitral valve. So when this rupture happens, the mitral insufficiency will occur. And here is the scar formation. We can see white scar here. There is the white scar. And in microscope, we can show this is the white scar. This is one of the complication of uh, scar formation, that is aneurysm or ballooning, and which can lead to the thrombus formation. Suddenly death will happen due to cardiac diseases. It is an unexpected. It occurs without symptoms, or it may be within 1 hour, less than in 1 hour after symptoms arise. Why it's happen? I already said arrhythmia is the fatal cause, and it is due to the acute ischemia, and 90% of the patients have pre-existing history of severe atherosclerosis. And what are the other common causes? It may be mitral valve prolapse, cardiomyopathy, cocaine abuse. What happens in cocaine abuse? Cocaine can constrict our vessel, leads to the ischemia. Chronic ischemic heart diseases. Poor myocardial function. It is due to chronic ischemic damage with or without damage. Progress to congestive heart failure. Okay friends, thank you very much. If you like this video, please make say thumbs up and share to your friends, and bye friends, have a nice day. Thank you.